So I wanted to do a really quick video and actually release two videos for you guys today. I wanted to start on my pathology course during the course of this review lecture videos. Grab a piece of paper and let's go. Hello and welcome to MK's Medical Review Series. My name is Dr. Moses Kazevu. This is a series on my YouTube channel where we look at medical topics in depth. If you haven't yet subscribed to the channel, please hit the subscribe button, hit the bell notification icon so you never miss on such amazing content every time I post. Drop a like, drop a comment to show some support, share the link to the page so that we get to at least 100 subscribers. Let's grow this channel together as it's a subset of our main channel, Dr. MK7. Here we're going to be covering a lot of the basics from our preclinical years. So I decided to start with pathology. So we will look at pathology. So welcome to your very first lecture of pathology. I'm sure you are looking forward to learn a lot. This is actually one of the most important courses because it lays the foundation to what you're going to be seeing in the clinical years. So in this particular lecture, we're going to be looking at pretty much what pathology is and the different branches of pathology. So if you look at the word pathology, we can divide it into two bits. There's what is known as pathos and there's what is known as logos. So pathos means suffering, to suffer. Logos means study. So when you talk about pathology, all we're simply talking about is the study of suffering, in essence, the study of disease. So it's going to be entailing looking at things like clinical features, which are going to be including signs and symptoms. Remember, a sign is what you as a doctor are going to elicit. You can touch a patient and you can see them wincing on their face. You're eliciting pain, you're eliciting tenderness. But if a patient tells you that they have a headache, can you really elicit a headache? It's very difficult to do. So a sign is what you, the doctor, can prove, what you can see, what you can touch, what you can hear. A symptom is what the patient is actually going to be feeling, what they tell you that they're feeling. So signs are objective, symptoms are subjective. Pathogenesis of a condition, pretty much how this condition develops and the things that are affected in the body. Different complications as well as morphological consequences, both gross changes of the tissues, what you can see with your naked eye, as well as macroscopic changes both in structure and function of the cells, tissues, and the organs. So it's going to be analyzing what we call the etiology, which is simply the cause of a condition, the development, which is pretty much the pathogenesis of a condition, and how it's going to be affecting certain changes in certain tissues, certain changes in certain organs, and these organs could be examined by taking a sample from living tissue, which we call a biopsy, or a sample from dead tissue, which is done during autopsy. So remember, for us to make a diagnosis, and for us to actually treat the patients quite well, pathologists actually have to identify changes in the gross appearance of a tissue, changes in the microscopic appearance of cells and tissues. How do you know that when you get a biopsy, when you send it to the lab, how do you know that there was chronic inflammation there? How do you know that there was acute inflammation there? It's because of the pathological examinations and the report that they give you back. And then, of course, you also have the biochemical alterations in the body fluids, such as blood as well as urine. So some definitions, etiology, like I said, it's the cause. When you think about causes, if you want to remember things very well, you should actually group the causes as either congenital, meaning someone is born with it, or acquired, meaning that they got it after they were born. It was most likely they were not born with it. It's not a genetic thing. It's not related to anything, any genes or any sort. But of course, both congenital and acquired may be somewhat affected by genetic factors, but most of the times the congenital things tend to be inherited and they tend to be non-infectious. Then in terms of underlying causes, you could also think of them as infectious versus non-infectious, where infectious could be caused by bacteria, they could be caused by viruses, they could be caused by fungi, they could be caused by parasitic infections. Then the non-infectious things are things obviously that are not caused by any living microorganism. Then in terms of pathogenesis, like I said, it's the steps in the development of the disease, how the disease is progressing from the etiology to the clinical features. It explains like the story that is happening from whatever is causing your disease to the symptoms and how the symptoms are coming about. So it's going to be describing how the etiological factors are actually going to be triggering these different cellular, even different molecular changes, and these are going to be giving rise to specific functional as well as structural abnormalities of a certain disease. So if you can think of it like this, etiology is why this person has the disease, and pathogenesis is how the disease is actually going to be developing. So in Zambia, there are predominantly two main branches of pathology that are practiced. There's what is known as forensic pathology, which is related to the law. It deals with examination of bodies that have died under certain circumstances. It deals with, for example, bodies that are brought to the hospital dead. That's the forensic side. Then you have anatomic pathology or clinical pathology, which is going to be pretty much the histopathology, looking at certain specimens that you're getting, certain biopsies. In terms of forensic pathology worldwide, it's largely divided into three main types. There's what is known as the coroner system, which is what we see in Zambia. I'll talk about it briefly. Then we also have what is known as the medical examiner's system and the procurator fiscal system. The one that we practice here in Zambia is the coroner system, and I think it's practiced in most countries that are colonies of the United Kingdom, and a lot of countries practice this coroner system. But in America, I think in some states of America, they use the medical examiner's system. So in terms of the forensic pathology, remember that this is going to be the branch that's going to be practicing medicine and studies that are going to be determining cause of death of a patient, or you're doing this because the government is actually interested in how the citizens are being born and how the citizens are dying, because it will actually help the government plan. For example, if we determine that most people are dying because of road traffic accidents, or most people are dying because of such and such infectious diseases, there are certain measures that the government can actually put into play, which is why these things are very important to report quite accurately. So it's going to be concerning examination of the dead for the purpose of the law. And like I said, there are three systems: the coroner system, which is what we practice in Zambia, the medical examiner system, as well as the procurator fiscal system. So in terms of the coroner system, like I said, it's going to be seen in most parts of the UK, some states of the USA, and even all Commonwealth countries that were British colonies. Like I said, Zambia is one of them. We are going to actually practice the coroner system. So here there are two things. There's the coroner himself, him or herself, the coroner who's going to be acting as the magistrate under a specific jurisdiction. Then you have the coroner's officers. These are the ones that are going to be investigating some of these cases. These coroner's officers are going to be the police officers, the admin officers, and most major hospitals, except where I do my practice at, but most major hospitals actually, if you notice, they'll have a police post in the hospital, because there are certain cases that have to be reported to the coroner. And what are some of these cases that have to be reported? If someone presents with an unexpected death, if there's a death because of a road traffic accident, industrial accidents, even plane accidents, or suicides, or homicides, whether it's murder, whether it's manslaughter, or deaths from industrial disease or poisonings that are happening even when they're treated in the hospital, or deaths that happen in public places, or deaths that are happening in prison, or deaths that are happening in police custody, or BIDs, those are brought in dead. And if someone is brought into the hospital and they haven't stayed 24 hours in the hospital, we consider them as brought in dead. So you still have to report that to the coroner. Like I say, deaths in public places like hotels, state institutions, or deaths that are arising from abortion, because remember, abortion is illegal in our setup here in Zambia, unless if it's under certain circumstances. I did a video on my main channel about abortion, so if you're really interested in that, you can head over to our main channel and actually have a look at that at our main channel. And then all deaths in which the doctor is actually not capable of stating the precise anatomical cause of death, it must be reported to the coroner. And all perioperative deaths, so meaning if someone dies on the table in theater, if the death is happening within 24 hours of the surgical procedure, you must report these cases to the coroner, because some of these cases, if not all of them, need to be investigated. So there are two distinct branches or two sub-branches of forensic pathology. There's what is known as anatomic pathology, which is going to be dealing with autopsies, getting tissues and samples from the dead, surgical pathology, and even cytopathology. Then you also have clinical pathology, where now you're going to be examining samples from the body. For example, if someone comes in drunk, how do you prove that they're drunk? You could get samples from the body for chemistry, for toxicology, for hematology, for microbiology, for blood banking, and even immunology, as well as samples such as tissues, blood, and body fluids. So remember that the forensic pathology is almost going to be exclusively be concerned with performing autopsies, especially in our case here. And some cases actually are going to require mandatory autopsies. Those cases that I told you about that need to be reported to the coroner, you don't even need to actually get consent from the relative. You actually have to perform an autopsy because you can't issue them a death certificate if they don't have the cause of death and if an autopsy hasn't been done. So these forensic cases require autopsy, for example, those that are suspected homicides, suicides, accidents, and the coroner must be informed about the case that is requiring an autopsy. Remember, it's the coroner that's going to be authorizing that the autopsy be done, and then there are some forms that have to be completed. The relatives have absolutely no say in this case, and the autopsy report is actually going to be used as evidence in court of law, where individuals actually may even be facing charges in terms of homicides. Then the investigating officer is supposed to be present during the autopsy. The relatives are not allowed to be present in the autopsy room. Then in terms of anatomic pathology, remember this is going to be dealing with evaluation of tissues that are removed either from living, which is a biopsy, or from the dead, which is done during autopsy, and is divided into three main areas. There's autopsy pathology, surgical pathology, as well as cytopathology. Remember, if you talk about general or histopathologists, they're just going to be practicing this surgical type of pathology where they examine tissues from living patients. And cytopathology is going to be examining pretty much cytology, cells. So in terms of autopsy pathology, remember this is examining the dead for the purpose of you actually determining the cause of death. And the clinical autopsy is actually requested by the clinician that is treating the patient. For example, if you're treating the patient and you just want to have better knowledge of the case, then you can request for an autopsy. In that case, then the relatives have the right to refuse or they can agree. But if it's one of those cases where you don't know the cause of the death, or it's one of those special cases that I mentioned earlier before, the relatives actually have no say on whether the autopsy should be done or shouldn't be done. So in this type of autopsies, the clinical autopsies, the coroner is not going to be involved. An authority to do the autopsy must be signed by a relative. So the autopsy report is going to be sent back to the requesting physician. In terms of surgical pathology, it's examining tissues for diagnostic purposes. So you can obtain the biopsies by two processes: excision, where you're cutting out tissue; incision, when you're cutting into tissue. And these specimens are often going to be put in a fluid to prevent them from decaying, to prevent putrefaction from happening. And usually the fixative that we use is formalin. I'm sure most of you have actually witnessed this formalin in the dissection room, 10% formalin. So the tissue is fixed in formalin and then it's going to be preserved for quite some time. And we can actually examine it under the microscope for a purpose of diagnosis, to confirm diagnosis or the type of disease, also to confirm the resection margins. For example, if you have a cancer that you've cut out, you want to ensure that the edges that you've cut out are free from cancer. If those edges are not free, it means you have to go back and you have to recut this patient and you have to open this patient up again. So remember that treatment of some conditions must be confirmed by tissue diagnosis. You don't want to start someone on chemotherapy when you don't have a diagnosis that this person indeed has cancer. In terms of preparation of specimens, remember that before processing, the sample should be fixed to the slide. You do this fixing. Then afterwards, you're going to be processing, you impregnate it with wax, and then you cut it and you stain it. And once this has been done, then you examine it under the microscope. So there are different stains that are actually used to examine different pathological conditions, to examine different tissues. So these special stains are actually required to actually show features of microorganisms, sometimes tissue components, and sometimes certain pigments. In terms of cytopathology, this is examination of cells for the purpose of diagnosis, screening, or follow-up. So you can actually get specimens like tissue fluid, like urine, sputum, where you look for specific cells. You could get fine needle aspirations of solid tissues. It's done with the thyroid, it's done with the breast. You could sometimes get scrapings, example of the skin. You could sometimes get imprints. This is actually a quite cost-effective type of way to do things, and it's quite quick. Some example of stains that we use are the pap smear, the pap stain, what you do in the pap smear, Gemza stain, and then the quick diff stain. Now, generally, our approach to pathology over the course of this particular playlist, we're going to be looking at general pathology, which is going to be focusing on cellular, even tissue alterations. It shouldn't take us so long, that are caused by certain pathologic stimuli in most of these cells. Then we also are going to dive into systemic pathology, where we'll look at various different conditions that are seen in different pathologies. So remember that nearly every disease is going to be associated with dysfunction that's going to be happening at the level of the organ, at the level of the cells, at the level of the organelles. So it means that there are going to be certain changes that are going to be happening in these cells. And you have certain techniques that can actually pick up these structural and these functional changes that happen in these cells, that happen in these tissues, that happen in these organs. Some of these things could be morphologic, some of them could be molecular, some of them could be microbiological, some of them could be immunological, some of them could even be some biochemical techniques that we actually use to actually detect these injuries and how these cells are responding to injury. So the things that you're often going to see, you can examine the tissue with gross examination, where you're going to be identifying certain organs, identifying the pathology, using gross features like the size of the organ, the shape of the organ, the consistency, and even the color. Sometimes you even use the smell. Then in terms of microscopic examination, one important stain that you're going to use is hematoxylin and eosin, which is usually the gold standard stain in initial light microscopy of most pathologic specimens. We could sometimes use some ancillary techniques where we use immunofluorescence microscopy. This is usually just limited for those patients that have renal and autoimmune conditions, and even transmission electron microscopy, which is going to be used also for those that have renal pathologies, those that have neoplasms, those with infections and genetic disorders. Some molecular techniques that can be used, things like southern and western blots, which could be used in diagnosis of HIV, protein electrophoresis, which could be used in diagnosis of sickle cell, polymerase chain reaction, which could be used in diagnosis of certain viral infections, like, for example, COVID, even some cytogenetic analysis like karyotyping and in situ hybridization studies, which could be used in the diagnosis of conditions like Down syndrome. Now, just before I end this lecture, I just want you to be able to distinguish between hematoxylin and eosin, because it's something that you're going to be seeing most commonly in pathology. So remember that hematoxylin is going to be binding mostly to the nucleic acids and the calcium salts. So it means that it's going to be staining things like the nucleus, which has nucleic acid, the nucleoli, the bacteria, and even the calcium. So the stain is going to be appearing typically bluish to even purplish in color. Eosin, on the other hand, is going to be binding to proteins, and these proteins are found in the extracellular space. They're also found in the intracellular space. So it can actually stain the cytoplasm, it can stain collagen, it can stain fibrin, red blood cells, even the thyroid colloid, and it's going to be staining pink to about reddish in color. I really hope you enjoyed this video on the introduction to pathology. If you did enjoy, consider subscribing to the channel. Hit the bell notification icon so you never miss on such amazing content every time I post. To Zambia and beyond, my name is Dr. Moses Kazevu. Until next time, bye-bye.